if you are just ordinary administrator with no clinical experience, that will be so fatal. There are decisions that you take as doctors, and you look at it in terms of budgetary allocations, forgone alternatives and everything, that every other administrator will look at you and they will think you are crazy. I just give you an example. I said, if, for example, I discovered there's an epidemic in neonatal units, and I've looked at the trend of that epidemic and everything, I decided to buy an instrument, which the money can buy many other things. But to you, you say, why will I use one thing to buy an instrument? Meanwhile, I can share it, I can do this, thinking under the business management. Okay, equitable distribution of resources. That is what management will teach you. That when you get a result, you must look at how do you distribute it. But I can decide to galvanize everything and spend it in one area by virtue of my knowledge of medicine. Okay. And that is why I said, what is my goal in taking my decision? My goal is that the children must not die. Okay. That's the example I've given. And that is the problem an administrator will face. I have also not come here to say, okay, it is a sacrosanct, it is a law. There's no law that says we must be. But I am saying for the sake of Nigerians, for the sake of that poor man,
okay, but
if you go to an institution
can I ask a question?
That does not have any
There have been
issue.
hospitals. There have been hospitals where the chief medical director or the CEO there is a doctor, and yet the hospitals are not properly managed.
And there are hospitals that are headed by administrators.
He talked about one just now.
There are hospitals headed by the same. That's why I said is.
Can you mention 5 in Nigeria?
No, you're asking if there was any evidence to that effect.
Can you mention 5 of those kind of hospitals in Nigeria?
There are hospitals in this country that are headed by administrators.
Can you mention 5 that is not running well?
Well, let me. I don't want to mention hospitals' name, but you and I know private hospitals in this country that other health workers have come together to set up. Today, within 10 years, they are no more. And you and I know hospitals that medical doctors have come together to set up. Today, they are standing strong.
Interesting. In Nigeria?
In Nigeria. You know. Interesting. I don't want to mention
can I ask you a question?
You know. And that is why Goda's study is so beautiful. Because Goda said something. No, you cannot. Okay. You see, this study, you cannot just come here and trash.
Sorry, can I ask a question? When was
Please, let me say something. Please. Let me. I didn't release Goda's study. So you cannot be asking me. Let me say something what she said. So he said, MD CEOs are more likely to prioritize patients because patient care is at the heart of their education and working life as a physician. When it comes to making hard budgetary decisions or rationing choices, MD CEOs may be able to make more informed decisions.
Sir,
you cannot come and throw that study.
One of the
this
greatest,
study was celebrated.
Sorry, can I say this? Because it's good for us to situate studies.
And from that small pool that you mentioned, that's where he got this. Which means, naturally, by virtue of statistics, you know, if I have 1,000 something, you talk, please. When you have 1,000 something, I just have 235 headed by, and from that 235, so-called insignificant number, you can still make such a wonderful.
Can I ask you two questions?
Beautiful submission.
Can I ask you 2 questions, sir? Did Godal ever write in that report that those hospitals were successful because they were led by doctors?
Yeah, that's what I've
No. I want you to read where she said so.
I quoted her.
No, sir. She actually said, okay, I'm not going to argue. The world can go to Google and Google that report.
People now, Journal of Social Science and Medicine.
Can I ask you a question? Is there any other country that has a better health service than Nigeria that legislated that the teaching hospitals or the hospitals should be led by doctors? Any country in the world that has a better health system than Nigeria that has that kind of a law? Is there any?
What kind of a law?
A law that specifies that a medical doctor should lead teaching hospital or any type of hospital.
Now, let me tell you something.
I just need an answer to my question.
You are failing in one area. And the area you are failing is so clear. And that is, as Nigerians, when we prioritize health of the patient, okay? And we decide to say this and this and this are the reasons.
Doctor, can you just say there's no country? There's no country.
Why can I say there's no country?
Because there's
I have not done my survey to discover whether there's no country or not.
And so what's the basis?
But you have not done your survey as well. Mention countries that are headed by administrators that have succeeded and we can hear the name.
I've given you data in the US.
No, in Africa. Mention studies in Africa.
I said countries that had better health services.
The same study you mentioned, I said out of this small pool.
A study
was done.
A study just came out from South Africa.
You don't have your question answer as well.
I have cited. You haven't.
I said out of those small people you mentioned,
yes,
there was a study that came out and said these people are still the best.
Okay, you know what, gentlemen? At this point, we'll take a quick break. And when we come back, we want to find out what are the benefits of a doctor, specifically laid out, of a doctor heading a health institution, and what are the benefits of having the administrator heading these health institutions. Simple. We'll be back shortly. Please do not go away. Welcome back. Well, my head was bent there. I was trying to look at the Gödel studies, but it's not opening out here. I wanted to pick out something Yomi said earlier about certain flaws in that study, and then still find out what Peter had to say about the fact that this study was done on 300 hospitals, even as Yomi insists that they were done on specialist hospitals, not just general hospital. But you have a question for him?
Yeah, I just want Mr. Yomi to know that he has been talking about 1,600 of just, you must understand the uniqueness of every country. Most of the time in America, how many government hospitals do you have? Trust, organization, they come together to establish hospitals. And when they come together, at the back of their mind, it is profit driven. And when I want to get money from my business, you don't want to bring in a compassionate person who will likely do surgery free, who will likely do something free, and therefore what do? You look for an administrator who doesn't care whether people are dying or not, as long as there must be profit maximization. I've worked before under a hospital headed by administrator. I was fired. Why? There are patients that I will see, I will tell them, you don't need medication. Just go and take water and everything. And the man came to me and said, come, I won't make money to pay you. You have to give them something. The patient cannot walk to you, and that is the problem. So you may see so many hospitals, how many of such that are established there under trust. So if these hospitals, out of this pool of 1,000 you mentioned, people came together, they formed the trust, they formed a hospital, the aim is for them to maximize profit. But we are saying that in Nigeria, our system is different, in the sense that the government have decided to set up a hospital with the aim of providing health for its people. And to meet that need, a seasoned doctor who is trained and versatile will head. And when they head, they will be able to take decisions that will ultimately result in less mortality, less morbidity, that is death and sickness, and will take the patient alive. There can be any other. In fact, now, are you saying that in this country now, if 2,000 hospitals, they spring forth, and then they make all of them administrators with the aim of generating money, you now run down and say, out of 2,300 hospitals in Nigeria, 2,000 are headed by administrators, and you now be using that for comparison, without knowing that these 2,000 came with the aim to maximize profit. But NME is saying, Nigerians deserve something. Nigerian government should do something for its people. Provide free health, provide subsidized health, give them good opportunity to walk 5 minutes distance to their house, let them see somebody. And that is why doctors, with that compassionate heart, will take that decision and manage very well. Yeah. But if it is to make money, I may even go back and say, okay, administrator, go and make money for me. When I establish hospital, I will make administrator there so that they can make money. So if it is hospital making money, then all administrators, anybody, head it and make money. But for the sake of Nigeria, that poor man watching this program now, if any other person other than doctors head the institution,
Chinamanda talked about the danger of a single story. I think that's your experience. You had an experience under a bad administrator, and you concluded based on that. Any good administrator is concerned about healthcare. I think it's also important for us to mention one single fact, and that's the fact that we're talking about organizational leadership. Two errors, I think, makes us get into problems in Nigeria is that we say two things. One, Nigeria is a different country, and that's why we have a law, and you couldn't cite any other country.
I didn't say that.
Okay,
don't quote me wrong.
All right, okay, I'm sorry.
Don't quote me wrong.
I'm sorry.
Our aim of establishing a hospital in Nigeria is for social responsibility.
And other countries,
and doctors will do that.
And
all the hospitals you have mentioned, they are funded by trust. And therefore, their aim is to make profit.
A trust is to make profit. A trust is a recognized and registered non-profit.
So do I go there? Do you know how much people pay when they go to hospitals?
But my dear, you remember that.
Do you know how much they pay?
Sorry,
they don't pay money in Nigeria when they go to hospitals.
You want to compare it?
No, just
but one of the reasons why your resident doctor went on strike, one of the reasons why your resident doctors went on strike in Lut was that they increased the cost of medical care in Lut.
Who are we fighting? We're
So
fighting
what are
the
we saying?
government. We're not fighting the administrator.
But don't forget,
when the
who is the
government
head?
will open,
Sorry.
when the government will say this year,
Sorry.
I'm giving social institution 10 million.
Can I ask you a question?
10 billion naira.
Can I ask a question?
When to even run a generator to power the hospital, they can spend up to 8 million.
But can I ask
or
a
8
question?
billion.
Can I ask a question?
So we are saying that our strike is not directed to administrator. It's directed to the government that come. This is the problem we are facing. Don't make these people to go and generate internal revenue. Fund the health sector. We are fighting for Ibadan. We are fighting for Kwara. We are fighting for Ilorin, Benin, everywhere. So please stop alluding. And that's why I said you can't just come here and make an allusion that my president was here. He was talking about the bad state of Luth or so. We are saying the situation we have in every institution, not just Luth, is that government listen to our cries.
Your last words.
Listen to our cries and do something. Not about the administrator heading down.
Is that your last word?
Not my last word. But let it
The potentials of a human being should not be limited because of what he studied. This country is going to be led by a zoologist. The potential of a country should not be determined by a human being by what he read or where he works. When leadership is consigned to a few individuals because they've read a particular course of study without any evidence of a significant development or training in leadership and management, we are setting ourselves up for failure. Today in Nigeria, our health numbers are horrible. Okay. We need to do something different.
All right. A quick one.
It's sad. I want to say that this is a sad moment, one of the saddest moments in my life. Because we're not looking at health in another dimension. I have seen friends who are nurses, they went back to medical school. Maybe they have a vision that one day they want to head their system. I've had friends who are, in fact, the president that came here was actually a trained physiotherapist. He wanted to be a doctor. The door of medical school is always open to anybody. When you know that you have, otherwise we'll be busting ourselves in a corner. Otherwise, one day, somebody who is in charge of maybe taking you home or anything will say, my potential should not be limited. I should be the CEO. One day, a typist in a courtroom will say, why can't I be the judge of this courtroom? My potential should not be limited. Yet, he refused to go to the law school. Okay. I think when we do that, we're making a wrong assumption.
All right. Thank you very much, Dr. Peter Ogunnubi, a medical doctor and a human life crusader. Thank you for coming on the show.
Thank you.
Mr. Yomi Fawehinmi, Human Resources Consultant, thank you for coming on the show.
Thank you very much.
I have a lot of responses here, comments here, but permit me to just take a few. My producer is already saying we have to go. Isife Sunday Uche says, doctor to the patient is like health manager to hospital management. The headship of the hospital has no medical or clinical function. Good Lord Josiah says, doctors are medically trained to manage patients. I feel they should face their jobs squarely. Don Corleone says, the hospital is an aggregation of different teams headed by doctors. Therefore, the hospital can be headed by a doctor. Quite a lot of comments here. Vinny J says, can we call in? Sorry, you can't call in. You can't call in, but this is what I would have to say. Thank you so much for letting us be a part of your day. Till we bring you another edition. Have yourself a good night. I'm Neo Taigwe.